Tonight on Healthworks, it was 4 a.m., too early in the morning for most joggers. The time didn't stop him, but something else did.
Gal walked over and asked me if I was okay, and I said, I think so. That was the last thing I remember.
Had it not been for a series of remarkable events, his life would have been over.
Up to 9 out of 10 people who have a cardiac arrest like this will not survive.
She was young, she was fit, and she had a congenital heart condition.
As long as I could still jog and do aerobics, I didn't want to go through having surgery.
We were really surprised when we came through the door and there was this young, healthy-appearing lady lying on the ground.
It was a combination of faith and modern technology that brought this woman through the most difficult experience of her life.
I read my Bible every day and I prayed.
A patient in her condition will usually not live to see a donor.
Tonight, Healthworks investigates matters of the heart and how you can use this information to protect yourself and your loved ones. And the Healthworks Challenge. Do you think you're heart smart? Average Houstonians take a stab at some seemingly easy questions, and what they learned would make anyone jump up and take notice. All this and more tonight on Healthworks. Good evening, I'm Bob Knowlton. Welcome to Healthworks. Many people think of heart disease as a health problem for men. The truth is, it's an equal opportunity killer. One Houston woman knows that for a fact. Cynthia McCarthy is a nurse in the pacemaker clinic at St. Luke's Episcopal Hospital. Every day, she helps her patients learn to live with heart disease. Her words have a special impact because they're based on personal experience. She's learned that heart disease can be lived with, but it can't be ignored.
It was the November of 1993. I had a day off from work. I was eating lunch at a barbecue restaurant, and I was going to go do some Christmas shopping afterwards.
She never made it to the shopping mall. It was an arrhythmia, an irregular heart condition she'd had from birth that changed her plans.
When I was born, my heart rate was only in the 70s, and for most babies, their heart rate is between 100 and 120.
The problem is with the conduction of electricity from upper to lower chambers of the heart. This is not a problem with blood vessels or plumbing, as some people might say. This is purely an electrical problem.
Normally, the natural pacemaker in the right upper chamber sets the rate and rhythm of the heart by sending an electrical signal to the lower chambers through a central node.
In Cynthia's case, a part of the conduction system of the heart was missing or was very poorly developed as a child. Because of that problem, the lower chambers were beating at much slower rate than they should be.
It was suggested to me that at some time I would need to have a pacemaker put in because my heart rate was getting slower as I got older. As long as I could still jog, do aerobics, I felt like I didn't want to go through the surgery to have a pacemaker put in, even though it had been suggested to me several times.
Postponing the pacemaker was a fateful decision that almost resulted in her death back in 1993.
I remember eating lunch at the restaurant, but that was it. The cashier at the restaurant told me that I just stopped eating, put my fork down, and kind of slid under the table.
Well, we were actually just leaving the office when a call went out for cardiac arrest at the barbecue.
Fortunately, a bystander in the restaurant had begun CPR almost immediately, extending Cynthia's life until an ambulance arrived.
When we arrived at the restaurant, she was still on the floor. I had sort of anticipated this older gentleman and was a little surprised. In fact, I was very surprised when we walked in. It was such a healthy-appearing young lady. Paramedics had got her heart restarted, but she was still very unstable.
Cynthia's slowed heartbeat may have been what caused her cardiac arrest, also called ventricular fibrillation. In that state, disordered electrical activity causes the ventricles to contract in a rapid, unsynchronized fashion. When this occurs, little or no blood is pumped from the heart.
If a person is in ventricular fibrillation, the time is very crucial. In about 3 to 5 minutes, there could be permanent, irreversible brain damage or death.
I don't remember anything until I woke up in the hospital, and that was about a week later, my family tells me.